Welcome to the Stanford SCI Medicine Clinical Fellowship. I'm Doug Ota, the Program Director. The Stanford SCI Medicine Clinical Fellowship is tailored to meet the unique goals and objectives of the individual fellow while providing all the elements of a core program. At the beginning of the fellowship year, we ask the fellows to identify 10 goals specific to the individual to achieve throughout the year. In pursuit of these goals, the fellow will receive training at nationally renowned hospitals and clinics. Fellows in the program will experience a broad and robust clinical experience covering all elements of care, spanning from the initial injury to end of life. Through the various programs in the fellowship, fellows have the opportunity to work with a patient population covering a diverse background and from a large geographical area that augments not only individual care, but also training in a system management approach. Our faculty draws on knowledge and expertise that supports the clinical experience as well as clinical research. The fellows will learn from numerous SCI board-certified specialists and experts in specialty fields that support the delivery of care to our SCI population. This directly includes plastic surgeons, hand surgeons, neurourologists, internal medicine, and critical care specialists. It also includes psychologists, pediatricians, chiropractors, neurology, and many other specialists available who provide ancillary care. Our health science specialists will provide education and training on clinical research and outcome related to quality management and quality improvement. Research and outcomes management are an important component of the fellowship program. Weekly dedicated time is protected throughout the entire fellowship year to provide ample opportunity to focus on research and quality improvement projects. At the beginning of the year, fellows participate in the Stanford ICCR, which covers extensively the conduct of clinical research and gives you a running start to design and carry out your own project. Current studies include a need DEXA assessment study, new funding for a mobile manual standing wheelchair project, and a study evaluating the experiences and attitudes with access to healthcare of the LGBTQ veterans who live with an SCI. Also, recent fellow projects have included an adaptive video gaming study, relationship between patient-specific factors and inpatient rehabilitation outcomes, and the development of a standardized weaning protocol for intrathecal baclofen pump removal. We have an active participation in multi-center trials such as the exoskeleton walking study and the decision tree on surgical options for the upper extremity. We also offer an advanced fellowship beyond the clinical training if you want to further hone your research skills. Additional program highlights include some exciting advancements. The Stanford Spinal Cord Injury Medicine Fellowship has been awarded funding from the Craig H. Nielsen Foundation to support additional rotations throughout our academic SCI system of care, including Stanford Healthcare Systems and Santa Clara Valley Medical Center. This can be applied to the inpatient, outpatient, and mixed rotations. The funding support starts with the 2024-2025 academic year. An additional highlight is Santa Clara Valley Medical Center is a current spinal cord injury model system. Clinical rotations occur at several locations. During the inpatient experience at VA Palo Alto, fellows will receive training and experience managing issues related to the acute spinal cord injury, including ventilatory management, as well as management of issues for individuals throughout the continuum of their life following the acute rehabilitation phase. These individuals will return to the VA Palo Alto inpatient unit to receive care for acute medical conditions, surgical care needs, wound care with advanced wound management strategies, and may include surgical flap closure, nerve and tendon transfer surgeries, wellness checks through annual evaluation, and care management related to aging with a spinal cord injury, including secondary rehabilitation needs, palliative care, and end-of-life transitions. At Santa Clara Valley Medical Center, fellows will work with individuals who have acute spinal cord injuries. An enhanced training experience is the Respiratory Rehabilitation Unit, which focuses on the ventilatory management and weaning under the auspices of a critical care specialist. Previous fellows have also chosen as one of the goals to spend time with the traumatic brain injury team during the rotation to enhance their skills in the managing of the dual diagnosis population. At Stanford, fellows will work with an SCI board-certified physiatrist regarding consult management at a top-level trauma facility. During the outpatient experience at VA Palo Alto, the broad and robust clinical experience continues through a complex and coordinated outpatient system of care that is modeled as a medical home. Here the fellow will continue to work with the SCI population as they return for post-rehabilitation assessments, medical care issues, wellness checks, and participate in a unique strength of our program, the numerous specialty clinics supported by experts in their respected fields under the medical home umbrella at the SCI Center. This delivery of care also extends beyond the outpatient clinic through the SCI home care team that travels regionally to see and provide care directly in the patient's place of residence. Also, as the SCI clinic manages care for these individuals over a large geographical area, a telehealth program allows the right care to be delivered in the right place and allows us to extend our expertise in a patient-centric model. Fellows will have the opportunity to participate in all the specialty clinics that occur in the SCI Center at the VA Palo Alto. These include, but are not limited to, the upper extremity and hand clinic, where individuals are evaluated for tendon and nerve transfer surgeries. The functional extremity clinic, where musculoskeletal issues are addressed, including ultrasound-guided diagnosis and therapeutic injections, intrathecal pump refills, sexuality clinic to address issues related to sexuality after a spinal cord injury, the collaborative ALS clinic, the plastic surgery clinic to assess surgical management of wounds, as well as the wound clinic for non-surgical approaches of wound management, but includes sharp debridement and other advanced wound management strategies, urological evaluations including urodynamic studies, cystoscopies and bladder Botox injections, chiropractic and acupuncture therapies, and the telehealth clinic. The fellow can also pursue additional clinical participation throughout the various healthcare systems spread amongst the various campuses. These include the various clinics at Santa Clara Valley Medical Center and Stanford, such as spina bifida, spasticity, rehabilitation urology, multiple sclerosis, musculoskeletal, and upper extremity clinics. In addition to the salary as a PGY5, Stanford Medicine offers additional benefits to support fellows on the move to the San Francisco Bay Area, as well as benefits to support their time during a fellowship training. Additional details can be found through the link for Stanford GME House Staff. This will include an update for the PGY5 salary, which soon will be available. These rotations allow time throughout the various campuses and capitalize on the resources to meet the SCI medicine milestones. The mixed rotations allow the flexibility of concurrent inpatient and outpatient experience, or alternatively, focused experience to one area, and is tailored to the goals of the fellow as well. With the Craig H. Nielsen Foundation funding support for the Stanford SCI Medicine Fellowship, additional rotations beyond the VA are available and will be designed with the specific SCI Medicine Fellow goals and objectives for the year. The clinical experience is one element that is critical for the education of a spinal cord injury medicine fellow. Other ways we support the education of our fellows include numerous educational offerings. Fellows attend the Stanford Division of PM&R Didactic Series, which has 4+ weeks of dedicated topics specific to spinal cord injury medicine. Weekly SCI core lectures are conducted that are fellowship specific. Journal Club is conducted twice monthly and is led by the SCI Medicine Fellow and includes the SCI faculty and residents spread amongst the campuses, as well as former fellows attend as well. Throughout the fellowship, additional education sessions are conducted, including the Neuroradiology SCI Review, where the radiographic findings are correlated with the clinical condition, review sessions to learn about neurourology elements, including understanding and reading urodynamic studies, and additional topic reviews when the fellow rotates at Santa Clara Valley Medical Center. The SCI Medicine Clinical Fellowship is designed to support the training of a complete fellow as they move to the next stage of their career. This includes the ability to deliver excellent clinical care, be a leader in the field with the ability to decipher information and present, understand information and data, including completing a quality improvement project and a research project. We support integration of clinical research exposure and training throughout the fellowship year. This starts with the week-long Stanford Intensive Course in Clinical Research. The course provides intensive training covering elements necessary to understand and conduct clinical research. It is protected, dedicated time for the fellow to participate in this special opportunity provided to Stanford faculty and trainees. Based on, but not limited to, the top 10 goals established by the fellow at the beginning of the year, other opportunities are provided or structured to help fulfill the individual fellow's goals and objectives for the year. Past fellows have observed nerve and tendon transfer surgeries in the OR that they assessed during the upper extremity and hand clinic, observed myocutaneous flap surgeries, observed urological procedures, worked in various clinics to enhance their skills performing procedures, including intrathecal pump refills and problem solving, chemodenervation nerve blocks for spasticity management, botulinum toxin injection for spasticity and tone management, and joint injections under ultrasound guidance. As the skills of the fellow progress throughout the year, they will take on the role of an attending to develop and guide management of the individual with a spinal cord injury in an integrated multidisciplinary team approach. The fellows are actively involved in teaching of PM&R residents through didactics and clinical mentoring. Through the various programs, the fellow can be an active participant, including peer support programs and the patient education sessions. During a recent CARF survey, the recreational therapy program was highlighted by the surveyors for the outstanding results, innovation, and creativity that is to be shared with the field. They recognize the extensive and broad range of services spanning music and art therapy, training for adaptive sports, outings, and community integration. They recognize the recreational therapy program is truly a model for other SCI systems of care to follow. A well-rounded fellow is one that not only pursues excellence in clinical training and education, but balances this with quality of life pursuits. The opportunities and offerings in the Bay Area have no limits. This includes many hiking and other outdoor activities. Whether it's outdoor activities, attending sporting events, cultural, art, and entertainment, life in the San Francisco Bay Area is defined by what the individual wants during the fellowship year. This includes amazing food options. Past fellows have graduated our program and moved to careers specific to their objectives. We are proud of each and every one of them. We are proud of our SCI Medicine Clinical Fellowship Program as it is based on a strong foundation of the core elements of an SCI fellowship and enhanced by further focusing the year to the individual fellow's goals. All levels of care are provided during the training experience. In our fellowship program, fellows will learn to manage individuals with spinal cord injuries and dysfunction, including traumatic and non-traumatic injuries. Fellows will be trained throughout the continuum of care, including the initial acute injury management, acute rehabilitation, pulmonary care, including ventilatory management, and transition back to the community. The training includes primary care management for individuals with spinal cord injuries and dysfunction, prevention and management of secondary conditions, management of acute and chronic medical issues, and extended surgical management needs. As the individual ages with a spinal cord injury, fellows are trained on the management of secondary and tertiary rehabilitation needs, palliative strategies, and end-of-life management. Our population may have concurrent medical issues, and the fellows are supported in their training with SCI-dedicated internal medicine specialists on the management of these individuals' medical issues. Our population may have a dual diagnosis, and fellows are supported in the training through the various campuses, including Santa Clara Valley Medical Center and the VA Polytrauma Center. A common goal for individuals with a spinal cord injury or dysfunction is ultimately to return back to the community, recapture their lives, to define their quality of life, and be supported to achieve this common goal. Our program supports all levels of care from inpatient to outpatient to home care to the telehealth program, ultimately to support them reintegrating back to the community. Additionally, their quality of life is supported through the numerous resources to support productivity and leisure activity, including community programs and adaptive sports. Graduates of our fellowship program remain as colleagues with us, participate in our journal club, collaborate to discuss operation and program elements, clinical care discussions, exchange best practices, and continue as close friends in our SCI community. It is also exciting to exchange updates on our professional and personal journeys with graduates of our fellowship program. We thank you for your interest in our fellowship program. Please see the following links to learn more about our program, the training facilities, and the SCI Medicine Fellowship. Please feel free to contact me or our program coordinator for any additional questions.